this obviously 15 credit course, and we've completed a discussion on whatever we so that our learning objectives they're complete now, and this session is discussion on your assignment that you have to submit 2 weeks from now. So yeah, we'll start. So the first assignment, obviously, if we talk about this, okay, if you have any questions in between, please let me know, Placidia. Okay, I'll clarify as we go. So, so in order to achieve this unit, you were required to complete 2 assignments. I think we've had a slight discussion about these assignments in our first session, but it's okay. I'll give you a detailed one now. So you're achieving your learning outcomes and meeting the standards which are stated in the assessment criteria for the unit. We'll talk about that assessment criteria also. So assignment 1 is that you should carry out the tasks in the context of a specific health or social care setting. And this setting may be related to your current job, whatever you are doing right now, or the job that you are looking forward to joining, or one specified by your I'm not specifying anything, but you can it's always better that you're doing something that's more closer to you, so that it's more applicable to you. And if you're actually going and making changes, it's a good exercise that you're working in, that's actually given in the example. Otherwise, you can use organizations providing healthcare, such as the NHS departments, any department that you can choose, it's up to you, or care homes also. So the first task is, as part of your professional development, your line manager has asked you to prepare information. This information will be used in the organization's induction program. So it's for new staff. Okay, so information, sometimes information has to be very succinct. So the information that has to be given to new staff, obviously, we're not going to go into too much of details, but you will just inform the new staff. This is what your objective is. So you should research and document the following and prepare a presentation. So that's the first task is demanding a presentation from you for your line manager. So you're giving your information here for the new staff. That's your objective. So the first part considers and explains the quality from stakeholder perspectives and assesses the impact of poor service quality on the stakeholders. So this is the first part of the presentation. So any idea what you could do on this first part? We'll just start discussing it.
Okay, let me just go to what I've done already. I just tell you what I did. Okay, the first part, I explained what service quality is, and what quality needs to be, what individuals expect, what service providers expect, and how you can maintain quality against standard.
Okay, and yeah, and who are those making the standards? You could add that bit also. So you have the CQs,
like the stakeholders. Yeah.
You have you have internal stakeholders also. You have external stakeholders. So don't forget to mention this also. Dividing the stakeholders into different forms, like your internal stakeholders will definitely be your patients, your internal stakeholders, sorry, will be your staff, obviously, and your line manager will be your internal stakeholder. But then your external stakeholder, when you're talking about you being, so what your role is, you have to understand your role. So your role is as a junior, and you're presenting this to your line manager. So your line manager has the authority. So you're not at that at this moment, you're not at that level. So we have to consider that you're a part of the team, and then you're explaining. So this, if it's an explanation, it goes a bit, you have to include more in it. So because when you're explaining something, it's more extensive. Whereas,
Okay.
yeah, whereas just if it's a definition, if you're just defining quality, it's going to be more precise. So this explanation has to be, so I would not say in your PowerPoint presentation, just give bullet points. That's the best way how to prepare a PowerPoint presentation, because it's not going to be a very extensive PowerPoint presentation. The number of slides has not been mentioned here, though. But what I would recommend, you should have speaker notes at the end. Yeah, so that will give you more in depth. You'll have the choice there to explain yourself further. So if in those bullet points, if they're very precise, as bullet points have to be, so you can then make use of the speaker notes. So you're considering and explaining the quality from stakeholders' perspectives. Very good. You start from what quality is from your perspective, and then you talk about different stakeholders, who they are, so that your the people who are coming to this organization, they're new, they can have an understanding of, okay, this is what a stakeholder means, and this is what, so you can define a stakeholder also, and then their perspectives you can explore around them and assess the impact. So if there's a poor quality service on the stakeholders, you can give examples also. We talked about within Shaw Hospital, we read about what happened and what were the recommendations, what went wrong. So you could give examples also here. So, but actually you have to assess the impact. So what could be the impact of poor quality service on the stakeholders? So obviously the external stakeholders, when you're considering service users, you have their feedback also. So if if you have poor quality service, your stakeholders will not be giving very good feedback, obviously. And then the second bit on this presentation is analysis, or so analyzes the potential barriers to delivery of quality health and social care services. Any barriers you can think of, Cecilia?
Yeah, I put in poor organization structure, physical barriers like for people that have special needs.
Mhm.
I put financial barriers, geographic barriers, cultural
Very good.
barriers, which is communication,
Mhm.
then inadequate training, stuff like
Mhm.
that.
Very good. Yeah, they're very good. So you can put bullet points, like you can have a slide for, because there's no slide number mentioned here. So you can go, that's up to you. So you
Mm.
can have a big, like a heading, and then you can have several subheadings in the presentation. So that's a good way to do it. So you should submit your research notes and presentation to your tutor. That will be obviously 2 weeks from now, and attach a bibliography of your research sources. So your references will be there, and ensure that they are clearly referenced in the text. Please make sure that while you're writing, and if you're writing something and there is references, ideally what should happen, sorry, excuse me. Ideally what should happen when you're, for instance, if you have a reference, you should be giving it, obviously it's in the text. So if you write in you've written a sentence, at the end of that sentence you will write the authors in Harvard style, author and year. And ideally, if there are not too many references, you can reference on that slide. Actually, that's easy for the person to see, okay, this is taken from this a reference site, and it's been mentioned on the slide also. Otherwise, you can always go and reference at the end of the presentation. So the last slide will have, 1 or 2 slides will have all your references there.
Okay.
Yeah, so make sure that when you're writing in text, so it's not just the reference list that you have to fill in, it's also within the text. So whatever you're taking from any other sources, just keep referencing them and reference as you're going. So don't leave it till the end that, okay, I'll do this at the end, or I'll make my reference list at the end. I'm just writing them in text. No, if it makes it easy for you that you start writing on a Word document, start your work on a Word document and just copy and paste on PowerPoint, like whatever's easy for you. But I will strongly suggest, because we think that referencing would not take much time and we can leave it to the end, but no, referencing I think takes a lot of time, and when you get it wrong, that's where your marks are deducted. That's the problem. So just good quality work goes together, like you're not leaving it for the end. Is that okay?
Yes.
Yeah. So any questions from task one?
Yes. You said I should use the like make examples with wooden shore.
Mm-hmm.
But the example I gave was when I was researching, I saw something about WHO, and I wrote effects of poor quality healthcare. So I just listed the effects, like four of them. Then
Mm-hmm.
I also listed poor services and nursing care. I listed quite a few things. So should I
Mm-hmm.
redo it or?
No, 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 no. I just know I was giving you an example. Yeah, I was just sharing an example because that's what came to my mind. You
Oh,
can use
okay.
any example. It's up to you.
Oh, okay.
Yeah, it's not mentioned. Nothing is mentioned
As
here,
far
but
as I give an example of what the effect
yes,
is on stakeholders and what the effect is on the care home, it's fine.
yes, yes, definitely.
Okay.
Nothing apart from that. Yeah. So this task will cover your assessment criteria 1.1, 1.3, and 2.3. We'll talk about that assessment criteria also in a bit.
Mm.
Now, your second task, there's a senior management team in your organization. They've decided to conduct a review of the organization's quality systems, just like CQC does it. And that's an external team, but then you have your internal team who want to do an internal quality check. You have completed work on perspectives of stakeholders in relation to quality and barriers to delivery of quality. This has been done by you through the presentation, which you presented to your line manager. And your line manager is now interested in your views. So she or he is a member of the senior management team themselves and has asked you to prepare a report. Now, a report is going to be different compared to what presentation is. So you'll have these um, several tasks. So you'll have to analyze the role of external agencies in setting standards for the sector. So any sector of your choice and any external agencies that are there. So we talked about several external agencies, but any others that come to your mind, you're free to add them also. Explain the standards. So you're the external agencies, what they are and their roles. So what are their roles basically? So CQC, what does CQC do? Anything to
Yeah.
do with quality. Yeah. So quality standards should be there. Explain the standards that exist for measuring quality in health and social care. So here we are just explaining the standards that exist. So here, the first one you're talking about the role, and the second one you're talking about which ones they are. The third point would be to evaluate the different approaches to implementing quality systems. So you have different systems. We've talked about different approaches, how to implement quality systems within your healthcare setting. So you can evaluate that. You can talk about that. Evaluate the methods used to evaluate or assess service quality. And this is with regards to external and internal perspective. So you're talking about external factors and internal factors also. And how are you going to evaluate your service quality? So for instance, you have we talked about external evaluation from patients or service users feedback. We talked about feedback from different other stakeholders such as CQC or the NHS itself. So you can use several methods. So you can give examples of, like, I'm just giving an example. So you can use feedback forms, you can use different other criteria also that we've discussed that are used to evaluate your service quality. And then in the end, so these evaluation methods, they can, this report doesn't, at the moment, doesn't give you a word count. So you're open to that. And then discuss the impact on service quality of involving users of services in evaluation processes. So what is the role of when you involve service users in the evaluation process? What is the impact on service quality? So if you're involving these people, if you're giving them, obviously, if you're giving them a feedback form, and what that feedback form will have, what impact it will have on the service quality, or what should it have. So this would be submitted to us, and at the end, if you're using any resources, please reference them. And also, again, as I said, in-text referencing is very important, as well as referencing at the end. So your assignment 2 will be a context where you're conducting the review. So that's assignment 1. So assignment 1 is, it comprises of your PowerPoint presentation to your line manager, and then followed by a report. Assignment 2, any questions from assignment 1, Placidia?
It's fine. I think it's okay. I have it on Word document. I just need to now move it to a PowerPoint.
Yeah.
So and add a few things to it.
Yeah, that's fine. Yeah. And then for the second bit, the assignment, we will, so the context is that you're conducting the review of the quality systems. So you're doing task 2, so it's an extension of task 2. And then the senior managers need to evaluate the effectiveness of their current systems, policies, and procedures in order to assess how successful they are in achieving quality. Senior management team, they've chosen a range of staff from different parts of the organization in order to obtain relevant feedback. So the different staff members that have been that are part of giving the feedback. So you have been asked to, so this is your task, record in detail your evaluation of the cost effectiveness of the systems, policies, and procedures in your organization in achieving quality in the services provided. So you're recording whatever evaluation you've done of the effectiveness of the systems, of the policies, and of the procedures within your organization in achieving quality. So how would you do this? Any idea?
I don't think I have an idea. What I just did was I explained what policies and procedure is. I outlined different policies, a few policies that guide the care home, and I now explained the requirements of the policies within the care home, like talking about staff being trained, medication management, recording, accident management, things like that. But I feel like I'm wrong. You
No,
know, when
that's
you just
fine.
feel
Yeah.
like you're wrong.
Yeah, sometimes, yeah. No, but see, when you record something, it means you're giving details of things. So you're giving details of things. What are those things? It's your evaluation of the effectiveness of your system, whatever your organization is, what's working best, what's working towards effectiveness.
Yeah,
So
I
any
don't know
policy.
how to start it. That's the thing. I don't know. Am I supposed to like create a table and say, for example, say recruitment policy? Then what do I do next? I just don't know what to do next.
So let's talk about it. Yeah. So your how is your recruitment policy made? Like, how does it work? So you're working to you have that policy in place. How is it working towards improving quality or improving effectiveness? So you're talking about effectiveness of the systems of policies. So this is a policy, you're talking about effectiveness of this policy in your organization. So how is this recruitment process improving the quality in the services offered. So are you keeping some criteria within your policy that you have to recruit these people? Or if you have, let's say, if you have, I'm giving an example, if you have a policy of CPDs, like for continuous professional development for your staff members, how does that achieve quality in the services offered? So any direct measures of quality, improving quality, or any indirect measures of improving quality, both are okay. So you'll have to think a little out of the box and think a little broader, that how could these support quality in the services that you offer. So you can talk a bit about what services you offer, and you can talk about what policies, systems, and procedures there are. So, and then you can talk about their impact.
Okay.
And yeah, let's say if you're talking about a policy of recruiting again, you can go and find research articles that talk about how recruitment should be done, and how, if recruitment is not done properly, or the quality of recruitment or the effectiveness of recruitment is not sufficient, what happens then? So you can give this, if you want to give more details, but it's more like about your own organization.
Yeah, that's what we do. So
Yeah, yeah.
yeah, okay.
So there's no right or wrong in this, obviously. It's up to you how you present your work. You can be innovative and talk about other organizations also. It's up to you. And you don't have much time also to do such extensive work. So I would say that it's best that whatever you do, it's covering all these objectives that should be
Mhm.
there.
Like
And
here, I'll just read one line to you. I said, staff in the care home go through special staff training for their role, which includes things like medication management, how to care for those who may have certain health conditions, and administrative procedure, including logging reports, records, and stuff like that.
Mhm,
Then I itemized all the things they do. Then I said staff require monitoring, coaching, you know.
mhm,
Then
mhm,
I now indicated the care manager's responsibility. Then
mhm.
I just stopped.
Yeah,
So,
that's fine. Fine. If
but
it's
you
covering
now say
your
I have
case.
to do how they recruit. So, is it the steps of the recruitment I'm supposed to now explain? Or
Yeah, so it's a of your evaluation. So you're talking about your evaluation of how effective these systems are. If you want to give details and talk about steps of recruitment, and if that improves your quality, it's okay. If that has an
okay,
impact
I
on
think it's the
quality.
result. I haven't written that because of these things. This is the result we get from the staff we recruit, isn't it?
Mm-hmm,
That's the part
mm-hmm,
that
yes.
is missing.
Mm-hmm. Yeah.
Okay.
So
Okay.
yeah. So you have to assess how quality is improved because of your particular recruitment process.
Okay.
Yeah.
Mm.
And the second bit will be analyzing and documenting other factors that influence the achievement of quality in your organization. So previously we were talking broadly, but now we're talking specifically about your organization in this report.
Mm.
So you're documenting, and first you're analyzing and then writing down what other factors influence. So you've talked about in systems, policies, and procedures, but
Mm.
now there's some other factors also that could influence your quality achievement within your organization. So you have to document these also, so that you're not left with anything.
Mm.
Is that clear? So let's
Mm.
talk about any other factors. So systems, policies, and procedures are there, but other factors could be maybe your finances within your
Yeah,
organization.
I have resources, skills
Mhm,
needed, perception, and
mhm,
information
mhm,
sharing
yes,
and procedures.
yeah, yeah. Anything that you can talk about, because this is to improve the quality of your organization. So yeah. And then in the third one, it's suggesting ways in which the organization could improve. So now you're
Sorry.
giving.
So this item now, I'm going to, like, for example, like this one says the service user expects individual expect to be properly informed about their processes and procedure. So I'm going to now explain how we do that, isn't it?
Yes.
In the
So
home.
in which point, sorry?
No, I said, for like, one of the points is the health service users being properly informed about processes and procedure, in order
Yeah.
for them to, have an expected result,
Yeah.
So I'm supposed to explain how we inform inform them about the procedures, like gaining consents and all that,
Yes.
right?
Yes. Yes.
Okay.
Yeah. So the first point, you're talking about all the system, how it works, and gaining consent, that's the part of the system. So that's how you're talking about. And then you're going to, and then based on these 2 points, the first and the second point, you're then going to suggest ways in which the organization could improve service quality. So you giving, so obviously suggesting ways could be your own ways. You could give your own opinions about it, but you could give opinions from research findings also. So if, let's say, your waiting time within your system is too long, and do you have ways in which your organization could improve uh, and on this bit? So you can take small bits on which your organization can uh, be improved. So that improvement doesn't have to be huge. That improvement can be very little also, but you have that bit. And when you've talked about any improvement or any suggestion that you've given, and it's research backed, that gives a very good impression to the reader. And then, yeah, you're presenting your findings to your senior manager, and you have all your references there. Your
And this one can
references.
be on Word document, right? Doesn't need to be PowerPoint.
No, no, no. This is just a report.
All right.
Yeah, it's just a report. Is that clear?
Yes, ma'am.
So I'll just stop sharing this, and then I will start sharing a bit about, yeah. Hello, Martin. Good morning.
Hello, good morning.
Good morning. You're okay?
Yeah, I'm okay.
Yeah, we were just discussing the assignment.
Okay.
Yeah, you have any questions, please have a look at the recordings, and I've spoken about what the assignment is about. We'll talk about a bit about the assessment criteria and the learning outcomes. So this can also give you a good understanding of what is expected from you.
It's okay. It's
Yeah,
okay,
any
no problem.
questions? Yeah, any questions now in between, please feel free to ask me. So here you have your learning outcomes. So obviously, when we had our sessions, we were talking about how the different perspectives of quality in relation to health and social care services. So your assessment criteria will be, we've talked about this, that the learner would be able to explain perspectives that the stakeholders in your care setting have regarding quality. This is a part of your assignment. In your PowerPoint presentation, you're analyzing the role of external agencies in setting standards. We've talked about different external agencies and in assessing how poor quality service would have an impact on health and social care stakeholders. So if there's poor quality, how would that impact the stakeholders' perspectives? So we're talking about perspectives of quality with regards to the stakeholders. Then in the second bit, the second learning outcome is understanding strategies for achieving quality in health and social care services. So you're explaining the standards that exist in health and social care that are there for measuring quality, evaluating different approaches to implementing quality systems, and analyzing potential barriers to delivery of quality health. We've talked about this. And then the third bit is to be able to, sorry, evaluate systems policies. So what are the systems, what are the policies and procedures in health and social care services? So you're evaluating the effectiveness of systems. So this is within your own system, your own organization. So once you've evaluated what, how quality impacts your stakeholders' perspectives and how your stakeholders have different impacts on quality. So then we're talking about what the potential barriers could be to achieving quality. And then the third bit is then talking about your system, where you're evaluating the effectiveness of your organization's systems, policies, and procedures. And this is while they're achieving quality in the services offered. Any system that you can think of which is running in your organization, or any policy or procedure, and how does it impact quality services, or how does it, is it something that you're doing unique that is impacting your system of quality within the organization, or is it something that you are following, some guidelines that you are following that are that the others want to know about and they could follow as well. So, and then in the second bit, you're analyzing other factors. So you've talked about systems, policies, and procedures, but there's several other factors also that can influence. So one very important example is your COVID-19. You can give an example of COVID-19 also. So that influenced achieving your quality throughout the NHS. So your system would also be obviously a part. So it can be a part, it's something that happened in the past, or something that you're forecasting, or you're thinking that this might happen in the future. So it might impact. It doesn't matter if it happens or not. I hope it doesn't happen. But yeah, this can be there as examples. And then you're suggesting ways. So whenever you're suggesting ways, it should be things that you would document through proper referencing, Harvard referencing style. So as I said, when you're referencing, please reference within the text also while you're writing. It doesn't matter if you're doing a PowerPoint presentation or you're doing a Word document, always reference while you're in the text. And then you're suggesting ways in which health and social services can improve their quality within your organization, obviously. And then the fourth bit is understanding the methods or methodology, for evaluating health and social care service quality. So you're evaluating methods for evaluating, for assessing or evaluating health and social care service quality. And this is with regards to internal and external perspectives. So how do they evaluate health quality within your organization? And then you're discussing the impact that involving service users. So if you've involved service users, they could be patients, relatives, anyone who uses your service. So how do they, what role do they play in the evaluation process? And how does that impact quality of service within your organization? So we've talked about these bits, so not going to focus on these now. We've covered all of this in our, so these are some barriers that you can talk about. And actually we have time, so I can actually discuss this. So you when you're understanding perspectives of quality, you have a very good, this is like a skeleton that can be used to draft your work or prepare your work. So you have your stakeholders like inspection bodies, several internal, external, and internal inspection bodies exist, your staff, it's your stakeholders, service users, and their relatives and carers and care professionals, managers. Perspectives on quality. So external bodies have they have their perspectives. Service users have their perspectives. Quality standards and quality measurement should be there. Quality control and quality assurance can be also mentioned over here. Certain external agencies that are there within the UK, they have their own standards. So you have the CQC, you have NICE guidelines, you have the SCIE, you have health service commissioners, you have local authorities, charities, for instance. What's the impact of poor service? So service users' needs are not met. Compliance issues are there. Targets they're not achieved on a regular basis. Risks of, so how do you discuss those targets if they've not been met? How within your organization, or how should it be that these meetings, so that for instance you have regular meetings and then discuss what targets there were, and if they've not been achieved, what were the reasons? So you have different techniques to assess how and to discuss what could be done next, what priorities you have, and how could they be achieved. And then risks to health and safety, welfare of service users, risks to staff. These are all the impacts of service, poor quality of service, that is of poor quality. The second bit, you have an understanding strategies for achieving quality in health and social care service standards. So you have standards set by the services. You have different charters, for instance, government and national targets. For instance, the World Health Organization gives a target and you have to achieve that. Whatever targets you have there that you think could achieve, help you achieve quality in your services. External standards are there, regulation and compliance, legislations are there to improve quality, quality. Codes of practice, if they're there, are they being implemented? If yes, how does it impact your quality? And if no, what are the reasons? Why are they not practiced? If they're implemented, why are they not practiced? Industry or sector benchmarks, you could have a discussion on that. Measurement, how do you measure performance, or how do you measure quality performance? Internal standards, including policy and procedural operations. So this is an example. These are examples of strategies that you can talk about. Implementation. So when you're setting targets, planning, monitoring, and reviewing, amending, this can be done. Plan, do, check and act, or plan, do, see and act can also be used. So a cycle can be used. Resources required to implement quality. What resources do you use while you're wanting to implement? Can you mute yourself? Sorry. Once I'm done, or in between, if you have any questions, please raise your hand. Yeah, thank you. So continuous quality improvement, CQI is there. You can talk a bit about that. Quality and management systems, ISO 901, you can talk about this and similar other standards. Total quality management, TQM, if you implement that, how is it implemented? And then we talk about barriers. So we have several barriers. You can have examples of interagency working. So when you have different stakeholders, you have barriers that come from them. Legislations and policies, can they act as barriers towards your quality? So always focus on quality. You're talking about quality improvement. Constraints of resources, we know that's an important barrier. Human resource, the staffing is there, but it's of not good quality. Let's say environmental and financial could also be there. Organizational structures, cultures, staff performances can also be considered as a barrier. So what do you do? Why do we want to assess these barriers? The reason is because if we have an understanding of these barriers, then and only then we will know where to focus our targets and where to focus more and focus less. So these barriers, that is why you have to actually assess what barriers there are and how would you go about to remove those barriers or minimize those barriers. and improve your quality of services that you're supplying. So, and then you will be able to evaluate systems, policies, procedures in the health and social care services. So how do you do that? Evaluating quality systems and procedures. So you have monitoring and review of quality systems, policies. You can talk about quality and compliance audits. So it's all evaluation. How do you evaluate your systems and procedures? We've talked about this learning objective. So do you have quality control systems within your organization? You have quality champions and quality circles that you can talk about. So it's an evaluation of within your organization of how systems and procedures, how are they there? How those systems, policies, or procedures are there to improve quality within your organization, and how are you evaluating the quality systems and procedures? So what are the influencing factors? Again, like above, we've spoken about legislation. You have standards and guidelines that you need to adhere to, availability of resources. So you have your policies there, but if you don't have resources there, how would that impact? Obviously, when you're talking about influencing factors, you're also going to talk how they impact training of staff, culture, and structure within your organization. And then at the end, you're suggesting ways of improving. So once you've talked about barriers, you've talked about what factors influence your quality achievement, then you're talking about improvement. So improvement always, it should come from, it should stem from the barriers, and it's always good to reference and give good references, give good evidence of what is there available for, what options are there available for improvement of quality. So setting high customer service standards, you could have a person-centered care planning. Even if you have it, you can have it, you can reinforce it, you can have it in your day-to-day routine. And then you have empowering your service users. Positive risk-taking can be taken as an example, empowering your staff, training your staff, giving CPDs, for instance, regular checks on how they're doing, giving them chances of improvement, utilizing your resources on training them, valuing staff. So how would you value staff? Is it the money that is going to show them value, or is it the level of empowerment that you're giving them? Is that giving them a value? So there are different values that you can give in different ways. Again, as I said, we think about ourselves as staff, but if it's backed by research, that gives a very good feeling that you've done whatever you've done. It's well homeworked. So and then communities of practice. So different places where knowledge can be transferred, different avenues where knowledge can be transferred. And then the fourth bit will be understanding methods or methodologies for evaluating health and social care service quality. So what are the different methods of evaluation? We've talked about different methods during our presentation. So you have informal service user feedback on a regular basis. So how do these feedback from how do these impact your quality services? Formal feedbacks can also be there. So you can have questionnaires, you can have focus group discussions, you can have interviews with the people who use your services. This is a good example of, so you can do focus group discussions on your staff as well, or questionnaires. Feedback from staff can also be taken. Reviews of complaints can be done on a regular basis. So you can use that method of evaluation. Surveys by external agencies, observational evidence. ServQual is a quality measurement tool. You can talk a bit about this. You can have benchmarking. You can have yardsticks that are there to achieve quality. And then the impact of service user involvement. So if you're giving them access to their own plans and you're making it more patient-centered or service user-centered, how does that impact your quality. So improvement of service user promoting, which promotes confidence and trust in the services, empowerment of service users and whoever's associated with them, and a better understanding and ability to respond effectively to service user needs. So that's about it.
Oh.
Any questions on this document? I'll stop sharing this if that's okay, and I'll reshare this document because some people have joined in late. I can't go through the whole document again because it is a bit long, obviously. But any questions on this assignment? So you have assignment 1, where you've been given task 1. You have 2 parts in task 1, and this is a presentation that you have to prepare. It can be your organization that you're talking about or any other organization that you can think about. So in this PowerPoint presentation, you have 2 points that you would have to focus on. Please reference within the text, Harvard referencing only. And at the end, you would be giving your reference list to us. Task 2 will be obviously after the presentation. You've completed your perspectives, and then you've been asked to prepare a report. So you have these 5 points that you would have to complete in your report. We've talked in detail. You can have a look at the PowerPoint presentation. Any questions, please do feel free to email me, ask me. Sorry. And that's the first bit of the assignment. So you have 2 tasks in the assignment. The second assignment is again has 1 task with 3 points over here, and then your it has only 1 task. Is that okay?
Yes.
Yeah, so any questions, please feel free. I don't think that you've not attended the session. You could always have a look at the recordings. It's always good to attend these sessions because you can have questions in between, and you can have very detailed discussions, and examples can be shared. And as I really like the way some students, they share their examples also just to check if they're on the right track. So yeah, you can send your assignment 2 weeks from now on, from this date. Yeah, if there are no questions, please make sure that there's no word count here, but make sure that if you're making a PowerPoint presentation, you should be giving bullet points, and then you can have speaker notes at the end, and then you could explain those bullet points in. So PowerPoint presentations, usually they have just bullet points and they're very brief in their design. They're not very, very extensive. So referencing is a must in the PowerPoint presentation also, within the text and at the end also. Is that okay?
Yes, it is. Thank you.
Yeah, you're welcome, everyone. So you're free to go now.
There's no
yeah.
class tomorrow, right? Just double
There's
check
no,
it. Yeah.
No, there's no. The last
Good morning.
class.
Good
All right.
morning. Good morning.
Good morning.
Sorry, yeah, I was having a little problem with my joining in.
Okay, that's fine.
Yeah. So do we have class tomorrow?
No, there's no class scheduled tomorrow. It's just today the assignment discussion that's done.
Okay, so sorry about that. I've been trying to join in since morning. My system was having problems. Oh.
That's fine. You could have a look at the recordings, and yeah, any questions, please feel free to email me.
All right, please do also remember to send me the email, the remaining email for the lesson. For the recording.
Sorry, I didn't get it.
Yeah, formally, there's sometimes we do send the recordings in the email, so I didn't get the last time one.
That's okay. I'll ask them. That should not be a problem. Yeah, in sharing with you the recordings.
All right. Thank you very much.
Yeah, you're okay. Okay, take care. Have a lovely weekend.
Okay, bye.
Bye. Good luck. Bye.